Are you focused on controlling your blood sugar and ignoring the dangerous signs of diabetes? Ignoring these signs could cost you. It's not just John, who has been living with diabetes for several years, who is surprised to think about complications. He never paid much attention to his feet until one day, he started feeling strange numbness. At first, it was only in his fingers, but then it gradually increased to his forearms. He thought it was just because he was sitting for a long time. But when he was silent because he no longer had feeling in his feet, he realized something was wrong. What he didn't know? His feet were sending red flags of diabetes complications. In fact, according to the CDC, 50% of people with diabetes have nerve damage, and nearly 130,000 Americans a year have a limb amputated due to diabetes complications. This is a serious problem, and one you probably haven't thought about. Today, we will analyze 7 warning signs from the feet about diabetic complications, before it's too late. I will explain each sign in detail with scientific evidence, and most importantly, share expert advice to help you protect your feet and maintain long-term mobility. 1. Numbness or tingling in the feet. Early signs of nerve damage. If you feel numbness, tingling, or pins and needles in your feet, don't ignore it. This is not only a normal sign of aging, but can also be an early warning of nerve damage due to diabetes. According to research, 60 to 70% of people with diabetes experience this condition, and it was also the first symptom that John experienced. The cause of this condition is that when blood sugar levels remain high for a long time, it will attack the small nerves, especially in the feet, the furthest from the heart and most vulnerable. Peripheral neuropathy occurs when nerves are damaged, leading to numbness, tingling, or pins and needles. The longest nerves in the body, from the spine to the toes, are the first nerves to be affected by diabetes complications, says Joel Zonsign, MD, director of the Diabetes Center at Montefiore Medical Center. That's why the feet often go numb first, followed by the arms and hands. The early warning signs of diabetes complications are often easy to ignore because they happen slowly and silently, causing many people to mistake them for signs of aging or just temporary fatigue. At first, it may just be the feeling of dry, itchy, flaky skin on the feet, but no one thinks that it could be a warning from the body. Then one day, you notice a slight numbness or tingling in your toes, but because they don't cause obvious pain, you don't pay much attention. Gradually, the feeling spreads down the foot, up the leg, but is still easily overlooked because it does not immediately affect daily activities. Some people may experience a feeling like ants crawling, like needles pricking, or even burning on the soles of the feet, but think it is just due to standing too much or wearing inappropriate shoes. More frighteningly, cramps or sharp pains often appear at night, causing sleep to become restless. The body is tired for a long time without finding the cause. If this condition persists, the nerves will be more seriously damaged, reducing sensation in the foot, making the patient not realize when injured. Many people who do not receive timely intervention have had to amputate fingers, toes, even hands, feet, knee joints, and more seriously, lifelong disability. According to the CDC, when a diabetic patient has an amputation, the risk of amputation is higher or lifelong disability increases significantly. Some patients have to have their knee joints amputated because complications are discovered too late. 2. Cold feet, a sign of poor circulation. John's feet were sending out a red flag about diabetes complications. That prompted him to see Dr. Tom. In addition to the numbness and tingling, he noticed something strange. His feet were always cold, even in hot weather. He recalled this summer, when the temperature outside was over 80 degrees Fahrenheit, but his feet were still icy cold. At first, he thought it was just the air conditioning. But when his doctor analyzed it, he realized it wasn't a weather problem. It was a serious sign of poor circulation due to diabetes. The body's circulatory system functions like a transportation network, where blood carries oxygen and nutrients to fuel each cell. When you have diabetes, persistently high blood sugar can damage blood vessels, restricting blood flow to your extremities, especially your feet. According to the American Diabetes Association, ADA, people with diabetes are 2 to 4 times more likely to develop peripheral vascular disease, PAD. This is a condition in which the arteries become narrowed or blocked due to plaque buildup, preventing blood from circulating properly to the feet. When the blood doesn't provide enough heat and oxygen, the feet feel cold. even when you're in a warm environment. John's doctor warned him that the condition can progress silently. Many people don't notice cold feet until more serious symptoms such as foot ulcers, loss of sensation, or gangrene appear, and even lead to amputation. Poor circulation is just one of many warning signs from the feet. If ignored, it can lead to more serious consequences. And this is only the second sign on a list of 7 warning signs of diabetes complications that every diabetic should know. John wondered, what else am I not noticing? Stay tuned for our next signs coming soon. 3. Changes in foot color, a sign of serious circulation problems. After Dr. Tom explained how poor circulation causes cold feet, John remembered a friend who was also on diabetes treatment. He asked the doctor, "Is a change in foot color a sign of concern?" He said that last summer, he noticed that his friend's feet were pale in some places and unusually dark in others. When the doctor heard this, he nodded and said that this was a dangerous sign that many diabetics often ignore. Dr. Tom explained that when blood cannot circulate properly, the skin on the feet will react by changing color. This can be a sign of poor circulation, infection, or even gangrene, serious problems that people with diabetes are at high risk of. According to the American Heart Association, AHA, peripheral artery disease, PAD, affects 1/3 of diabetics over the age of 50, causing reduced blood flow to the feet, leading to a lack of oxygen and tissue damage. The doctor asked John to call his friend for a closer look and to show him how to recognize the typical color changes that diabetics often experience. If the skin on the feet is red, it could be a sign of inflammation or an abnormal increase in blood flow. Sometimes the body tries to compensate for the lack of oxygen by increasing blood flow to the area, but this can also be a warning sign of underlying inflammation or infection. If the skin on the feet turns blue, it means that the tissues in the feet are severely deprived of oxygen. When blood doesn't circulate properly, the skin cells gradually lose the oxygen they need, causing the feet to appear pale or purple. This could be a sign of peripheral artery disease, PAD, or another serious circulatory disorder that requires immediate medical attention. The most dangerous is when the toe turns black, as this is an emergency warning. Black means that the tissue has begun to die due to gangrene. If not treated immediately, gangrene can spread, causing dangerous infections and leading to the risk of amputation to prevent complications from spreading to other areas. John began to worry that he now had 2 warning signs, but his friends around him had other symptoms that they had not noticed. If the feet can reveal so much about diabetes complications, how many other signs are being overlooked? Keep watching and leave a comment below if you have any of these signs. 4. Ingrown toenails, thickened nails, and fungal infections, signs of a weakened immune system. John continued to listen as Dr. Tom explained another sign that many diabetics don't notice until it's too late: deformed, abnormally thick, or fungal toenails. At first, John thought this was just a cosmetic issue, but the doctor quickly pointed out that toenails can reveal a lot about a person with diabetes' overall health. The doctor explained that persistently high blood sugar can weaken the immune system, making it harder for the body to fight off bacteria and fungi. Since toenails are moist, poorly ventilated areas, they become an ideal environment for fungi to grow. According to the U.S. Centers for Disease Control and Prevention, CDC, diabetics are 2.5 times more likely to develop fungal nail infections than people without diabetes. Poor blood flow also plays a role. When blood does not circulate well to the feet, toenails do not receive enough oxygen and nutrients, causing them to grow slowly, become abnormally thick, and become easily deformed. The doctor asked John to examine his toenails carefully and showed him how to recognize 3 common signs that people with diabetes often experience. The first is ingrown toenails, which occur when the toenail does not grow straight but curves down, piercing the skin, causing pain, inflammation, and a risk of infection. If not treated promptly, the surrounding skin can become more seriously damaged, even leading to diabetic foot ulcers, increasing the risk of dangerous complications. In addition, thick and rough toenails are also a sign to note. When the nail becomes abnormally thick, brittle, breaks easily, and may warp, this can be a sign of poor blood flow or nerve damage, which slows down the growth and renewal process of the nail. Another problem that many diabetics experience is fungal nail infections. When infected with fungus, the nail often turns yellow, brown, or opaque, becomes brittle and breaks easily. If not treated promptly, this condition can spread, causing pain and damaging surrounding tissues, making treatment more complicated. According to research from the U.S. National Institutes of Health, NIH, 25% of diabetics with toenail infections are at risk of developing foot ulcers, increasing the likelihood of requiring serious medical intervention such as surgery or amputation of the toe. If changes in the toenail can warn of such serious complications, what other signs do you not know? Don't leave. Let's continue to analyze sign number 5 of diabetes complications with Dr. Tom. 5. Hair loss on toes and legs. Dr. Tom continues to analyze the signs of hair loss on toes and legs. This is not only a sign of aging, but also an important warning about blood circulation problems. He explains that hair loss on the legs or toes can be an early sign of poor blood circulation, a common complication in diabetics. When arteries are blocked or narrowed by plaque, blood cannot supply enough oxygen and nutrients to the hair follicles, causing the hair to thin and disappear completely. Dr. Tom emphasizes that this is one of the most silent signs. Because it is not painful or uncomfortable, most patients do not notice this change until more serious symptoms appear. However, if you look closely, there is an accompanying sign that diabetics should not ignore. If you notice that the hair on your legs disappears and your skin becomes smoother and shinier than before, it is very likely that there is a serious problem with blood circulation to your legs. But this is not the scariest sign. The next 2 signs can be even more serious. Keep watching to know sign number 6, an important warning about dangerous complications of diabetes. 6. Foot deformities. When your feet aren't what they used to be. John began to understand that diabetes not only affected his blood sugar, but also silently destroyed his feet in ways he had never imagined. His anxiety grew as Dr. Tom continued to explain the deformities that could occur if the condition was not well controlled. Diabetes not only attacks the internal organs, but also weakens the nervous system and blood vessels, directly affecting the muscle control of the feet. When the nerves are damaged, they cannot send the correct signals to the muscles and bones, causing the feet to gradually become unbalanced and change shape over time. One of the most common deformities is hammer toe, where the toes permanently contract and curve downward, causing pain and making walking difficult. Another dangerous condition is Charcot foot, which occurs when the bones in the foot become significantly weakened, easily broken or dislocated without the patient realizing it due to loss of sensation in the foot. If not detected promptly, the foot can collapse completely and become severely deformed, increasing the risk of foot ulcers and even leading to amputation. According to the American Diabetes Association, ADA, Charcot foot is one of the most dangerous complications of diabetes, which can lead to severe deformity and the risk of amputation if not detected early. The extremely dangerous reason why many diabetics do not realize that their feet are changing is because nerve damage that has caused loss of pain sensation can be the most dangerous signs. You may be wearing shoes that are too tight or putting too much weight on your feet without even realizing it, explains Dr. Tom. Over time, your joints and bones become damaged. Your skin starts to callous. Your sores appear. But because you don't feel any pain, you continue to ignore them. Until one day, your feet are no longer the same. John was worried that his feet might be silently speaking to him. He just never looked and checked them. So keep an eye out for sign number 7, a sign that could completely change the way you view your feet. 7. Foot ulcers, slow healing wounds. John was worried about cold feet, hair loss, deformities. All the signs that he had never noticed before now became serious warnings about his health. But what really worried him was when the doctor mentioned slow healing wounds, something he had experienced before but never thought it could be a sign of a bigger problem. In fact, he had a small scratch on his heel from a shoe rubbing against it. At first, he didn't think anything of it, simply thinking it was normal. But the scratch took several weeks to heal completely, much longer than before. He thought it might be because his body no longer recovered as quickly as when he was younger. The doctor explained that diabetes not only increases blood sugar, but also silently damages blood vessels and nerves, significantly slowing the wound healing process. When a person has diabetes, 3 dangerous factors occur at the same time. Poor blood flow causes blood vessels to be damaged, unable to deliver enough oxygen and nutrients to the injured area, slowing the healing process. Nerve damage causes the person to lose feeling in their feet, and they may get cuts, scrapes, or blisters without realizing it, giving the wound a chance to become more serious before it is discovered. A weakened immune system means the body is no longer able to fight bacteria effectively, making wounds more susceptible to infection, increasing the risk of ulcers and gangrene. Dr. Tom went on to list the warning signs that a wound is turning into a foot ulcer that John should pay special attention to. If a cut, scrape, or blister does not heal after a few weeks, it could be a sign that his circulatory system is having a serious problem. If the area around the wound becomes red, swollen, or hot, this could be a sign of a potential infection. And if the fluid oozes from the sore, accompanied by an unpleasant odor, it is a sign of a serious condition that can lead to dangerous complications if not treated promptly. Things that John once thought were normal, cold feet, shiny skin, hair loss, even a small cut that won't heal, are all warning signs that he never really paid attention to. But the real question is, how many people out there still don't realize this? So it's important to share these signs with your friends and loved ones. The feet are the part of the body that bears a lot of weight, affecting your daily activities. But if you have diabetes, your feet are also the most vulnerable part. A small cut, a callus that seems harmless, can become a big problem if not properly cared for. Protecting your feet is more than just a daily checkup, choosing the right shoes, or trimming your nails properly. It's also about maintaining a healthy lifestyle to keep your nerves and blood vessels working properly. The most important thing you can do to protect your health and prevent diabetes complications is to control your blood sugar and maintain a balanced diet. Your body not only needs stable insulin, but also important nutrients to protect your nerves, improve blood circulation, and reduce inflammation. A proper diet will not only help you control your disease better, but also increase your body's ability to recover, preventing damage before it becomes serious. Have you ever wondered what foods can help you better control your diabetes? What foods can help improve blood circulation, ensuring oxygen and nutrients are delivered to every cell in your body, especially your feet? What foods can reduce inflammation, protect nerves, and prevent numbness and peripheral neuropathy? And do you have to cut out carbs completely to avoid complications? Or are there smart choices that can help you stay healthy without feeling restricted? Leave a comment about your experience with any of these signs. And be sure to subscribe, because understanding proper nutrition can completely change the way you manage your diabetes. See you in the next video.